if you think about the healthcare costs in America, it's not that the doctors are making more money. There's a huge administrative layer that makes up most of the cost. And if you think about, just take a step back and you're like, why?
Thanks for hopping on today, Mustafa, and being our guest on the podcast today. So first, can you tell me a little bit about yourself and your role at Navierre? You've got a unique background as both an actuary and an entrepreneur. So how did that shape the way that you think about the healthcare ecosystem and how you started Navierre?
No, it's a pleasure to be here, and thanks for taking the time. Yes, my background is fairly interesting. I am an actuary by background, spent about 2 decades in the insurance space. My passion in the insurance space was always about finding risks before they happen and using data as a way to kind of really tackle that. But my world really took an upside down turn in 2020 during the pandemic. I'm married to a physician, and she was at crossroads as well in her life where she wanted to do something a little bit different, right? So she really was interested in helping people stay healthy at home and away from the hospital systems. So we had opened a simple medical office. And in doing so in 2020, right at the pandemic, we got to really touch the lives of thousands of people. And at that time is when we really found that there was a real big problem. And prior to starting companies, etc., I'd also started a charity foundation. So I always had this entrepreneurial mindset of kind of trying to really get something out of nothing and then build something up. So when we opened the medical office, that was step one of a journey that then I was looking for a bigger problem. Then when I found how difficult people's journey was in health, navigating health, the journey that healthcare providers have, the blind zone that insurers have, I said, it's time to do something. It's a massive problem, but it needs someone to tackle it. And that's kind of where it all started.
You had mentioned you got some early wins from life insurance. How did you end up finding product market fit with Navierre?
Yeah, it's really kind of, it's interesting when you think about healthcare. People often think about healthcare doctors or providers. They think about health insurers. They think about you as a person, as an individual who kind of is the consumer in this particular case. But if you take a step back, there are a lot of other entities who are vested in your overall well-being, right? It could be, in some cases, it could be people, employers who care about your longevity. But what we found is that life insurers are starting to really get concerned about the life expectancy and the longevity in the US in particular. So just to kind of give you a couple of facts, over the last couple of 5 years or 10 years, longevity or life expectancy has either dropped or stayed flat. If you compare that to the rest of the world, where people have been living longer and the onset of medical advancement, the onset of early diagnostics and things like that. So you kind of really take a step back and you say, wow, we have a problem. So life insurance companies obviously have put a long-term bet in you living longer, and they had expectations that medical advancement would really take shape and people would overall live healthier, and there was the movement towards that. But reality is people are dying younger. The reality is people are dying from things that can be avoidable. So they have taken, a step in that direction of trying to really help their policyholders, their customers, with better tools to navigate their health journey. So that's where we found our kind of, if you want to call it, our initial early win. So we've announced a strategic partnership with Swiss Re, which is one of the world's largest global reinsurers. So they insure insurance companies. So they're really vested in this topic, very concerned as well. So that's kind of how we found that early win at life insurance. But the same ethos can apply to health insurance and others, but it's a little bit of a process to kind of really get there.
Interesting. Yeah. The point on longevity and life expectancy is super interesting because, the US is the country that spends the most on healthcare. 1/5 of our GDP is healthcare, but the outcomes aren't there. And, I was not aware that in the last 5 years, our longevity and life expectancy had flatlined, so that's interesting.
Yeah, if you look at the healthcare spend per capita in the US, it's massive, massive. And if you compare it to all the other countries in the world, the sum of, if I call it their bubble size, the sum of their bubble size would still be smaller than the US, but their life expectancy is several years ahead of us. So it kind of tells you that there's a problem. And I think the problem is pretty large. It's a more of a systemic problem. So
Yeah, let's talk a little bit about that problem and discuss kind of the current experience for the insurers. You mentioned providers and patients. Like, what do you think is fundamentally broken today with that experience? I think you had a very powerful story on your own website about your mother's medications.
Yeah, so I mean, to give you a real life example, right? My mom has she has an autoimmune disease and is on several medications. The personal experience was that she was prescribed medications that technically should have never been taken together, or it was essentially kind of really double dosing, triple dosing in some cases, and there were now she would never know about it, right? I would never know about it as well. But fortunately for me, I was married to a physician, and when she was just kind of randomly looking at mom's medications, she was like, "Why are you taking these? Like, they should never be taken together." And this kind of highlighted a very sort of fundamental and systemic issue, right? Which is that providers don't talk to each other. It's a fragmented, siloed system. So oftentimes, you kind of run the risk of these things happening because either the providers didn't really catch it. You might be using different pharmacies. They may not catch it. You might be using the same doctors in the same healthcare system. They may not catch it because they all want to use different systems, and the data, which is the most powerful thing here, it's not shared equally, so that people can deliver the care. So that really happened with my own mom, and I've seen this happen, more and more now with a lot of patients. To be honest, it's a kind of a fundamental issue that while you and me are the most important pieces, if you want to call it, because we are the eventual consumers, oftentimes data is very, very fragmented about our own health, right? And it becomes a very big issue to receive care, to identify risks, to really navigate your health, because it becomes very cumbersome to really even do the basic necessities. Forget about finding ways to live longer, even the basic stuff, it becomes hard.
Yeah, wow, that's a powerful story. It sounds like what you went through with your mom like opened up your eyes to a lot of these issues with at the end of it is data fragmentation, but really comes down to providers not speaking to one another. And that's a whole world in its own with data interoperability. But specifically for you guys at Navierre, I saw on your website you have this like brilliant like healthy reef analogy, coral reef analogy for those that aren't non-ocean folks. I mean, myself, I'm an ocean guy, but I love the analogy. Can you break down what that means in practical terms? Like, what does a healthy reef look like when we think about the experience for providers, insurers, and patients?
Yeah, the reef analogy is really kind of it's really core to what we are working on. And it is really that in a reef system, for example, every single piece of the reef or every part of the reef has a role to play. And the only way the reef becomes healthy is that everyone delivers the value that they are creating and understands that that's how we have to operate, right? So in this particular case, if one part of the reef breaks down, the reef breaks down. So the way we are envisioning and the way we've built our ecosystem is that we use something that is really powerful, which is data. So data can really feed each part of the reef the ingredients that it needs to really then sustain and be able to deliver the value that they can create in this. So what does that really mean tangibly, right? As a consumer, we empower you with all the information and knowledge about your health and then guide you along so that you can really do the right things at the right time. So what does that tangibly mean? You have access to your medical records no matter where they are. You can connect your wearable devices. You can find doctors no matter what health insurance you have today or tomorrow. You can bring your family members into one platform. So really giving you convenience and giving you personalization and having really a one-stop shop for everything that you may need. And within our consumer journey or health, individual journey, we also bring in other partners because we know that we cannot boil the ocean ourselves, right? So if there's a specialist in a particular area, we'll bring them into our world. So the end consumer gets really the value of what they need. On the healthcare provider side, I saw this firsthand with with my wife, who's a physician. She had no time to spend with their patients. Sometimes only 8 minutes, sometimes 6 minutes, 10 minutes. If you're a patient, you share more with your provider if you once you break the ice, right? And sometimes you have to break the ice all the time. But if you have no time with the provider, how are you going to really share what is really deeply concerning about you and your health? So in that particular case, on the provider side, we've built an end-to-end platform that automates their workflows so the doctors can get more time with their patients and things like that. So replacing a lot of the point solutions that are there that add more cost. They don't really work together very well. Bringing AI to making more better use of AI rather than the word AI itself, actually making an impact. So giving them a little bit more time and power to deliver. And the third one, which is really interesting, is that people oftentimes only blame insurers when it comes to healthcare. But insurers also are vested in your health, but many a times they don't have access to the data that actually they can see what might happen in the future because they're predictors of the future, right? I mean, I'm an actuary myself, but oftentimes they're starved of that data. And for whatever reasons there are some complicated reasons, but starved of the data until the claim event happens, and only then they can react. And it's too late, right? You can't influence when the event has already happened. You can only influence when you see a warning and you need to do something about it. So that's what we do, is that we kind of figured out a formula that feeds each one to really kind of figure out their role and then maximize their role.
That's great. That was a very comprehensive breakdown of how, the Reef for all three of those parties, insurers, providers, and patients. And I want to talk a little bit more about the impact, like any numbers, stories, or examples of how the healthy reefs are working in the real world. I think like one thing that stood out to me from the work that you guys are doing is these like business cards that providers have that like patients can scan. So what can you just give us some examples of that? Because I know all the reefs in the ocean that aren't at the same level of health, right? So what separates the healthy reefs versus the not as healthy reefs from what you're seeing?
The only way to solve the US healthcare system is that each reef needs to know that there's another reef on the other side, and they also need to live and breathe, right? But that's where the problem really is, really, to be perfectly honest. That, for example, these large health systems, they think that they are the only reef. But remember, over the next 10 years, they're going to move around. They're not going to live in one place. They're going to move to a different part of the country, right? So you have to allow them to take their information. There might be another reef. Empower that reef to kind of really do well. But I think the problem that we have in the American healthcare system is that anytime, let's call it, a fish enters the reef, that reef does everything so that the fish never leaves the reef. But just remember, the ocean is massive, and fish are known to migrate for warmer waters or for breeding or for food. So that's how life is. So every reef has to understand that. Like when you have maximize your value and let the other reef also, like the person can go to the other reef because they might have to go for whatever reason it might be. So I think that's basically what I would say. But so we're trying to solve it about it in a different way. What we're trying to do is that, but business cards idea, it's a very simple thing. Most of the time, patients struggle to find doctors because they don't know what insurance they take. Doctors are hesitant to put their name out there and have an online scheduling system, whatever, because they have to pay for referrals. And sometimes patients don't show up. They still have to pay. So what we did was said, hey, let's keep it simple. That's our top of the funnel. We're going to add value to healthcare providers, giving them a free like digital card, a free appointment and referral system so that they can host it. They can put it on whatever socials, whatever they want. So we're trying to encourage people to come in to their reef so they can add value to them, right? So that's just enabling providers. Now, there are many solutions out there, right? There are many, many booking systems out there, but most of them they cost money. We're just coming in free. Like we don't want to make money on that. We want an impact. We want you to be found, and we want people to find you, right? So that's the first step in our journey to get to market, is that we're just going to give it out. Any provider, whether it's an imaging center, whether it's a mental health counselor, whether it's an at-home nurse, whatever it might be, we will give that out because we want you to be found and we want people to find you, right? And we've already seen like the value that creates, because there's a lot of providers, as you said, they're not on modern tech, and this kind of gives them a leapfrog into modern tech without actually having to incur an expense.
Yeah, right on. I love that analogy that you gave with like, patients are the fish, right? And fish naturally need to migrate from one reef to another. The ocean is massive. They may have different needs. They relocate and, but oftentimes in the current system, the reef does everything to keep that patient there and not let the fish move from reef to reef. And I especially love the top of the funnel value that, you're providing with these business cards for providers and to put that anywhere, whether it's their social media, texting a patient like, hey, here's our business card, here's what we accept. I love that. And so why aren't like more providers, insurers like adopting this like healthy reef mentality or of allowing these patients to like go from reef to reef, Like why aren't more doing that?
Health insurers are mostly, they only have you, they think they only have you for 1 year because of whatever reason your employer may change your insurance from year to year, etc. So they're not vested in your long-term health, right? They're mostly vested in how can I just make sure you don't end up with a huge event in the emergency room or in the hospital, right? So it's a very kind of like, where are the low-hanging fruits? I'm going to focus on the low-hanging fruits, and that's all I'm going to do because that's going to, reduce my cost significantly, right? So that's kind of one aspect that people don't realize is that health insurers are also businesses, right? And they don't have endless supply of funds either. And so they also have to protect, for example, what they have and maximize what they can do. But they're only focused on 1 year, which causes a little bit of a problem in terms of investability for a longer period. On the healthcare side, you have kind of two camps. You have the large healthcare systems that just want to keep growing and keep growing and keep growing, right? Absorbing all the small little fish that are in the pond. And for them, they think they are the world, right? And they think they are the reef, and that's the only thing that exists. But I think what really has happened in the market is that services that are rendered at hospital systems cost 3 to 4 times more than they would cost at an independent healthcare provider. So, for example, in the world where we live today, where their deductibles are 5, 10,000, you go for an MRI at a health system, it'll cost you $3,000. But if you went to a down the road small imaging center, it'll cost you $500. But these hospital systems kind of they grab you and then want to maximize the value that it can create. And all these things are just, triple, four, quadruple, 10 times the fee. So there is a misaligned incentive there too, right? It's like you're in the door. I'm going to make sure I'm going to keep you in the door, right? And all these other ancillary services, they're all going to cost you more. If there are procedures at the hospital, there is a lack of transparency about the cost, so it ends up costing more. So I think that's the other part. On the consumer side, I think people have just become scared of healthcare, right? They don't want to engage with it. They think it's just going to cost too much money. At the end of the day, they're already paying a lot of premiums, and they'll just say, well, if really something bad happens, I'll do something. If nothing happens, I'm just going to stay low and not do anything about it.
Yeah, that point you made on like my eyes popped when you talked about some services being 3 to 5x more at larger health systems. That happened with my own mother in South Florida, where she was trying to get an MRI and it was 3 to 5x more expensive at the health system she was going to versus a nearby imaging center that she wanted to get it at, and it was her as the consumer that made that determination. Like, hey, if I just go to this other imaging center, it's going to cost me a lot less. I'm going to get the same exact scan, So that leads into what we talked about how patients are like the fish, and sometimes they need to migrate from reef to reef, right? Because of different needs.
Yeah, especially in this case, look, it's not everyone can afford if you have, let's say, a $5,000-10,000 deductible, you have a family that you're kind of protecting them against like really bad health outcomes. And $5,000-10,000, you might be like, oh my God, this MRI is going to cost me too much money. I'm not going to do it, right? But you have options. And I think that's where the world is moving to, is that data has to be interoperable so that the fish can go where they want to go to get the care that they need. The health system's role, I think, has to change from being focused on leakage, which is a very common term that they use, that how many people leaked out of my system, to service. Focus on what you're good at. Like if you're good at cancer, do a damn good job at cancer, you become the known brand for cancer, right? And I think there are already some academic institutions like that if you want to go for knee surgery, you go here. If you go for cancer, you go here. But they're focused on service, right? But I think that's kind of where I think things have to change towards. But it's a very big lift. There's a lot of things that need to happen. But the first thing that needs to happen is you have to empower the consumer, recognize their role, And you have to be transparent about costs, because at the end of the day, you may not share the cost up front. Then you have a high deductible. And guess what happens? When people get bills for high deductibles and they didn't know about the cost, consumers don't want to pay either. So it causes friction. So if you
Yeah.
think about it, everyone loses.
Yeah. 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 Everyone plays a part in the reef, the fish, the coral, the larger prey and predators that come in like sharks, and people don't know that. Yeah, so spot on. And I want to go back real quick to a point you made on misaligned incentives and how like insurers are not incentivized by long-term health typically, and they, mostly focus on 1 year health. You earlier mentioned you've had some early wins with like life insurance. Did those two things relate?
They relate so I'll explain a little bit about what I think needs to happen for health insurers to be more vested in your beyond just the urgent stuff, right? The overall cost of healthcare has to come down so that it allows you to invest in other things that are preventive in focus, right? So that has to come down, because if the basic stuff, like if you think about the healthcare costs in America, it's not that the doctors are making more money. The doctors are not making more money. There's a huge administrative layer that makes up most of the cost. And if you think about, just take a step back and you're like, why? I mean, if you buy a car and the service costs 400% of the car, you'll be like, what the hell? Right. So it's essentially the same logic that I think that has to shift over, that the admin costs have to go down. It has to be more frictionless so that then you can have a little bit more leeway for health insurers to kind of start to invest. Now, health insurers have to, through Obamacare and things, ACA, have to provide some preventive care, but it's bare minimum. It's not at the level that you need to have it at. On the life insurance side, they look at your health in a 20 years, 30-year, 40-year bet, right? So in many ways, they know that, hey, if you were to detect cancer 5 years earlier than if you already at stage 3 or stage 4, that is very important. Now, let's just take that as an example. In the health insurance world, if you have these early diagnostic precision medicine companies that detects cancer 5 years from now,
Yep.
they would probably say, well, you only are with me for a year. I'm going to now incur more costs for the cancer treatment versus what would have happened in 3, 4 years. I didn't have to pay for it anymore. So when a life insurer would say, hey, if you detect it earlier, then you may be able to do something about it, because by the time it's developed to stage 3, stage 4, you're now fighting for your life, right? And a miracle needs to happen. So that's just for like cancer, but there's also other issues, right? So metabolic risks, which is insulin resistance and diabetes, pre-diabetes, and things like that. Those are getting undetected at the moment because people are not getting their annual checkups done, their blood works done, etc. Honestly, those are covered by health insurance for free. They're preventive care covered, but people are just generally scared of healthcare, so they don't even engage in that. So this is the role we play. That our role in the life insurance world is that we're going to encourage you, Bert, to go do the right things. Make it easier for you to get the stuff that you need. Because long term, something as simple as annual checkup. It's a very interesting fact, and it's a big number that I'm going to tell you, but there are clinical studies that basically say that if you go for your annual checkup, you reduce your chances of mortality or death by 30 to 45%. So if you just think about that, right? It's your annual checkup. You can find out what's wrong with you. And if you ask anyone, when was the last time you went to the doctor? I can tell you the number will be between 5 and 10 years, right? On average. Or sometimes it's never. Like I went when I was 18.
Those real life examples are spot on, because from detecting cancer early, metabolic risk screening, annual checkups, like, all on the theme of like preventative healthcare. And that's becoming more and more, a trend in the industry. And as technology gets better, we will get better at detecting, cancer earlier, doing like understanding your metabolic risk ahead of time, right? So it's going to become more and more important that we look at health, and not just a single year, but in decades, right? And so for the folks like listening and, and thinking like, how can they engage with you and your team online? Is there any sort of like reef assessment that you guys offer, to look at how healthy your reef is and how interoperable you are with other reefs? How can someone like engage with your team online?
Yeah, I mean, if they go to Navierre.com and they can reach us out through there very easily. There are various ways they can connect through us, whether it's to the team or such. I'm generally very approachable on LinkedIn. People can find me, reach out to me, and happy to chat, happy to see how we can solve the problems and the challenges that they might be facing in their own businesses, etc. We're a startup. So we're always looking at things on how we can make an impact on society, how we can make an impact on the business and be a solution that is very unique in its own way. So those are the kind of couple of ways. They can also email us at either directly to myself, Mustafa@Navierre.com, or even info@Navierre.com, but various ways. We're very, very happy to kind of connect with anybody that thinks that this relates to them in some ways or the other.
Yeah, now, folks, if you're looking to build a healthier reef or a more interoperable reef, you know who to reach, Mustafa at Navierre.com, and, check out the website. So,
yeah, I mean, I think there's a lot of good movements in the market, like value-based care has been talked about. There's still some pain points there, I think, that needs to be sorted out. There's other alternative ways. Managed care is coming back in some parts of the country. But again, always have to remember, consumers are fish.
yeah.
They will go from A to B and to C and to D. And how do you empower them while at the end of the day, everyone has the same common vision of improving health outcomes versus increasing costs? It's a tough one.
Yeah. Yeah. No, spot on. And it's amazing that you guys can help through various angles, not just the fish as the patient or the consumer, but also their insurers. You mentioned managed care, also providers like practices, smaller practices, health systems. So it sounds like you guys can really cater to those different audiences, which is nice.
Yeah, which was our first, most challenging thing, Bert. I think we built a multi-sided platform. Most startups don't. They build only a one-sided platform, serving one customer. We understood the problem, right? We understood you cannot solve this in a one-sided equation. It's not a one-sided equation. It's a multi-dimensional problem, and we did it in a way where we thought it's possible, sustainable, and scalable, right? And the quick wins kind of get us further along our mission. And we're super excited about the impact we can create. Super excited about solving the problems like I faced with my mom, the thousands of patients we saw, and we were working with, and we still work with.
Yeah. I love that.
One life at a time. So.
Right. I love that. Everyone plays a role in the reef, and you guys are, helping every piece of that, and you understand the problem is not one-sided. Everyone plays a role, which I love. All right, Mustafa. Well, thanks so much for, being our guest on today's podcast. And it was a pleasure speaking to you today. Thank you.
No, thanks for taking the time. Thanks for having people like us to share our story. I think we need more of us to kind of really come forward, and we'll all come together and solve the problem.
Right on. All right. Thank you.
Okay.